My name is Dr. Greg Anderson. I'm an orthopedic surgeon specializing in sports medicine, specifically shoulder, hip, and knee at CommonSpirit Health. I picked sports medicine because I was an athlete growing up and I saw a lot of colleagues and friends get injured, and it could be a devastating thing for them. I also was able to see them on the road to recovery and get back to playing or participating at their previous level, and that always kind of inspired me. Today, that's a lot of what I do. People play sports or do activities at different levels, whether they're a professional athlete in the high school level, playing pickleball, or just going on daily walks. When people have pain that doesn't let them do what they love, it can be a really difficult thing. And I like being a part of the process that gets them back to doing things that they enjoy. CommonSpirit is a fantastic hospital system. They have really prided themselves on hiring the best and the brightest. I think part of that is hiring people that are collaborative and communicate well. When I look at myself and my colleagues, we have had excellent opportunities to train at top-notch places across the country. And as such, we're up to date on the most current evidence, treatment strategies, and modalities to get people back to where they want to be. And this is everything from conservative management and care to surgical interventions if needed. And so it's nice for a patient to be able to go somewhere and know that they're not getting some rogue treatment, but they're getting the state-of-the-art, top-of-the-line treatment to get them back in action. A big part of a visit with me, hopefully first thing you notice when I walk in the door is that I hope you feel comfortable and that you feel at home and that you can talk about your problem without feeling weird about it. A big part of getting people to feel better is knowing what has happened. So I spend some time getting to know the patient. How long have they been having pain? What hurts? What makes it worse? What have they tried? And then I'll examine you. And part of the exam is making sure that everything fits together. Does the details that I got in the story, do they match up with what I examine? And then usually we get x-rays as well, or some type of imaging. And then it's kind of like being a detective. We're putting all those things together to come up with a good treatment plan to get you feeling better. Outside of work, I really like spending time with my kids. I have 5 kids. We really like fishing. We like going to the movies, where my wife and I basically just run carpools all day. Our kids are highly involved in sports and music and just doing kids stuff as well. So my life really is a lot of my kids.